Let's explore how we can support and empower sex workers within our community. Community empowerment is about letting sex workers take control of their lives. It involves educating, training, and supporting them to create change in their working conditions and health services. Addressing violence against sex workers is crucial. Many sex workers face abuse and harm. Communities need to work together to support victims, provide safe reporting mechanisms, and engage with the law enforcement for their protection. Community-led services outreach are programs run by sex workers for sex workers. They provide information, education, peer support, and linkage to health and social services. These initiatives are critical to reach sex workers who might not access traditional services due to stigma or fear. Safe spaces are venues where sex workers can express themselves freely, access health and social services, and connect with peers without fear of judgment, stigma, or violence. Community committees and advisory groups allow sex workers to participate in the design, implementation, and evaluation of programs and policies affecting them. They provide valuable insights and guidance to improve the relevance and impact of these initiatives. Condom and lubricant programming is vital in promoting safer sex practices. Providing easy and free access to these items can help in reducing the transmission of HIV and other sexually transmitted infections. Clinical and support services for sex workers should include regular health checkups, counseling, and treatments. These services should be respectful, confidential, and adapted to the needs of sex workers. Voluntary HIV testing and counseling is a key strategy to prevent and treat HIV. Sex workers should have easy access to these services and be encouraged to test regularly. Antiretroviral therapy helps people with HIV live longer, healthier lives. It's crucial that sex workers have easy access to these treatments without facing discrimination or judgment. Sex workers are at an increased risk of tuberculosis, especially if they are living with HIV. Regular TB screening and integrated HIV/TB treatment services should be provided. Sex workers who use drug need specific services, like needle exchange programs and opioid substitution therapy. These interventions can reduce the transmission of HIV and improve their overall health. Regular STI screenings and treatments are important to prevent and control the spread of infections. These services should respect the rights of sex workers, ensuring confidentiality and consent. Sex workers have the same right to sexual and reproductive health services, including family planning, safe pregnancy care, abortion services, and cancer screenings. Sex workers often face mental health challenges due to stigma, discrimination, and work-related stress. Providing access to mental health services, like counseling and support groups, is essential. Supporting sex workers is a community responsibility. Together, we can create safe, healthy, and empowering environments for all.